Citizen activists from Wisconsin United for Freedom packed a Capitol hearing room on Tuesday over the Wisconsin Department of Health Services plan to add yet another shot to its childhood vaccine schedule. No, it was not the COVID shot. This time it was a meningococcal vaccine. The number of shots on the vaccine schedule has tripled in the past 40 years, and Wisconsin United for Freedom says it is completely out of control.
So we're talking about 76 doses of vaccines from pregnancy through 18. How many is too many, and who gets to decide? I certainly don't want it to be the government, and I think the people that are showing up today would agree with that, as well as physicians.
DHS can't add the shot without the legislature's approval. Its request was denied 3 years ago, and now it's trying again. The state's public health officer, Dr. Ryan Westergaard, attempted an appeal to emotion.
Because if children die, their grieving families will deserve to know, did we do everything that we could to prevent their kid from dying? In public health, just like in hospitals, we want to be able to answer yes. Yes, we did everything we could to make schools and daycares as safe as they possibly could be. Yes, we did everything we could to translate the best available science into policies that are most likely to improve health and the least likely to allow harm. The only acceptable number of childhood deaths from vaccine-preventable diseases is 0.
Is there an acceptable number of deaths from those who take take and die?
No, it is our goal to use vaccines, to review vaccines, to understand their safety so that people know the risks and to be ready for rare events such as anaphylactic shock so people can be aware of the risks and respond and save lives in the unlikely event of an adverse event.
Westergaard's reputation was battered by his role in the Evers administration's dishonest response to the COVID-19 crisis, regularly pushing ideologically based policies and mishandling real-world data.
In the spring of 2020, I was on a conference call with you and a number of my colleagues, and it was regarding COVID and the shutdown. And you had mentioned then that we could be shut down through 2020 and into the spring of 2021, which was shocking. It was after that I went to my caucus and said, we've got to go to court. We got to get the state opened up. And when I look back, there was that urging of everybody to mask up, shut down, don't go anywhere, and my gut was telling me this is not right. And we went to court, as you know, and fortunately we opened the state up. And so when we look at that past history, and a number of things that were just flat out wrong, and kids have been harmed because of the school shutdowns, how do we trust you? And honest to God, that made me so angry back then, and even now, I'll be honest with you, when I see you, I refer to you as Wisconsin's Dr. Fauci.
2020 was a scary time. I don't recall saying that I anticipated that the state would be shut down, whatever that means, for more than a year, but I very likely said that we could be dealing with a deadly pandemic for a period of time that could be over a year. So at that time, public health, we used the tools that we had, the best available science, and admittedly, that was a brand new virus, a brand new pandemic. We did not have science guiding what should be the best policies. So we proceeded, given what we knew from other diseases like influenza, like SARS, and implemented the strategies that we thought would keep people safe to minimize the amount of community spread of the virus, with the hope that we would sometime within the next year be able to have safe and effective vaccines which could turn the pandemic from a very deadly disease to one where fewer people die.
Wisconsin United for Freedom takes solace in knowing that any parent in Wisconsin can get an exemption from the vaccine requirements simply based on personal conviction. It's just a matter of getting the word out.
We stand for freedom, we stand for liberty, we stand for personal choice on this on this issue, and we honestly want the government out of our lives. We want to just live our lives, take our children to basketball, feed our kids dinner, and we don't want the heavy-handed government reaching over us telling us what to do.
The Joint Committee for Review on Administrative Rules plans on making a decision about DHS's request on Thursday, March 9th. For the McIver Institute, I'm Bill Smolsky.
But it's the same process